My name is Eliza Lyles, and I'm going to be doing a educational informational video about types of drugs that treat mental disorders. I'm going to be referencing our textbook. That's where I got all of this information. With that being said, let's get started. I'm going to be talking about conventional antipsychotics versus atypical antipsychotics. Conventional antipsychotics are drugs that we saw commonly in the 1990s or before. There are older antipsychotics, and they are not commonly prescribed anymore because of the effects that they elicit in our patients. And these effects being pseudo-Parkinsonisms. Um, Parkinson's disease is caused by a lack of dopamine neurons, whereas the muscle rigidity and tremors we saw in our patients as a result of conventional antipsychotics was caused by the blocking of those dopamine receptors and an abundance of dopamine in our patients. So this is why we see our atypical antipsychotics prescribed more commonly now. Uh, our atypical antipsychotics work by working on serotonin and dopamine receptors. In our atypical antipsychotic administration in patients, we saw less pseudo-Parkinsonism effects, and we saw more positive effects in these patients. So this is why these drugs are more commonly prescribed. An example of a conventional antipsychotic would be haloperidol. An example of a atypical antipsychotic would be Geodon. A teaching point for patients who are prescribed these drugs would be to expect a lag period. In this day in society, a lot of people are under the impression that a pill is a fix-all, and with antipsychotics, it just doesn't take a day or two to see the therapeutic effects of these medications. And I feel that we should really stress this point to our patients so they don't have an unrealistic expectation and give up on the medication too quickly before they've given an ample amount of time to see the effect. So 10 to 14 days is usually how long those lag periods last. So that is a really important patient education, and I wanted to end on that. I hope you learned something, and thanks for listening.